Hi everyone, my name is Anita Iyer and I run Ekansh Trust in Pune. Demystifying Disabilities is a video series of interviews with medical specialists and experts on disabilities, prevention, detection or diagnosis and early intervention. Today we have with us a very experienced plastic surgeon, Dr. Saxena. Welcome to the show, Dr. Saxena.
Thank you very much.
Let's begin with the questions. Our first question to you is, what are congenital disabilities? What are the congenital disabilities that you come across in your specialty as a plastic surgeon?
See, congenital disabilities are still prevalent. Previously, the numbers were too high, but now the numbers are going down. But still, despite the years and despite it being still in the low socioeconomic strata, we still see lots and lots of congenital disabilities. Recently, I had operated upon a very difficult and a different case, which is a Tessius cleft. So, if everybody knows the Batman series, so very similar kind of thing. The Joker had a bilaterally lip cut over here. A similar kind of a patient I just operated few months back. For the prevention of the identity of the patient, I would not like to name anything beyond that. But you see, these are the congenital anomalies which are very common. So trying to name the congenital anomalies in the frequency what they occur. So it's mainly cleft lip, cleft palate, where you can understand lip is cut in between by birth. Palate is that there is a hole in the structure inside the mouth so that the child is not able to speak properly. These are one of the commonest anomalies where the facial disfigurement occurs, and they are very common. Apart from that, if you look upon polydactyly, a person having 6 fingers, syndactyly, a person having joint fingers, macrodactyly, having a bigger than usual broad thumb or any other finger, and combination of all these anomalies, amniotic ring finger, where their fingers are already amputated. Some might be very small, some might be big, bent fingers, so they are constricted, and the contracted fingers which are already there. Apart from that, club hand and other finger anomalies which are also common. If we move apart from the hand, some patients have bladder issues, not exactly I would say bladder issues, but hypospadias and epispadias, where the portion from where they pass the urine is not formed completely. So these are known as basically hypospadias and epispadias. I am mentioning only those categories which come under the preview of plastic surgeon to operate. So I'm not talking of other congenital anomalies right now, which are like heart disease and all, which are also a congenital anomalies, but not under my domain. So I'm talking of those things which the person should be aware that the plastic surgeon is the right person to treat you for these kind of cases, and he is the right person to be contacted directly, not through a general practitioner, not through a surgeon, not through an orthopedic surgeon, but come directly. So one should not assume since it's a finger kind of a thing, first let's go to an orthopedic. No, the plastic surgeon is the right person to be contacted upon.
So they can come directly to you without a reference?
Absolutely. They should come directly to us, because the problem is that when they go to a general practitioner or a general physician, or maybe to a person who is not exactly a person who is trained, they lose a vital amount of time. So in very crucial is for the speech and the other development to operate these patients at a particular time. Like we have got a particular lip, you operate around say 10 weeks time, around 3 months of age, in a broad layman term. The palate is not to be operated at 3 months of age. It has to be operated at 9 months of age. We find many patients coming after 2 years when the development of the speech has to a particular extent has already happened. Now we cannot give you the same kind of results what we can give you when we operate at 9 months of age. So, and despite all these things, I still operate upon educated patients, educated family, educated patients from the family, where everybody is educated and coming to us after 3 years or 4 years of age of the child, which is not the correct age to get operated, because the results are always compromised, and you cannot give the same kind of results what I could have given it at the 3 months of age, or maybe at operative at the 9 months of age.
The next question is, are any of these conditions preventable, and if yes, how?
See, most of these conditions, I would not say exactly, we cannot determine whether they are preventable or not preventable, but yes, there are certain factors which are more prone. So if it is mostly genetic in nature, so a proper genetic screening during the pregnancy might actually help you out. So if you get a proper genetic screening done during the pregnancy, the parents can actually take a call whether they want a child or they don't want a child, and whether it is a treatable condition or it's not a treatable condition. Again, you have to remember that having a cleft lip doesn't deprive the child of any kind of long-term problems. Okay, I have my friends who have cleft lip. I have my colleagues who are having cleft lip and cleft palate. I have senior advocates. I know senior lawyers. I know builders. I know good affluent people who are having those cleft lip and cleft palate. And they're doing very successful in their life. So one also has to remember, diagnosing prenatally doesn't mean that it's everything has to be taken for as a taboo. Diagnosing means knowing things proper and trying to avoid those things if there is a genetic predisposition, and taking the right decision at the right time. Okay, and one has to understand that they are not taboo. Okay, even Ritik Roshan is born with the extra finger. Okay, Amir Khan has got a bad sear. Okay, all these are correctable problems by a plastic surgeon, but that doesn't make them a taboo, or they make them good or bad. So
It doesn't
we
really
have to
affect their
realize
quality of life.
yes. So now one thing about the prevention is that a proper screening, especially in those patients where we know that there is a genetic predisposition, or as such screening in each and every patient who goes for a birth. So proper screening is an essential thing, especially when there are predisposing factors. Second thing is proper dietary intake. Certain vitamins have to be taken, like pyridoxine, folic acid. They have to be taken at a proper time during the pregnancy, so that we can prevent these kind of congenital anomalies. There have been proof linked to all these kind of multivitamins, where but your gynecologist is the ideal person to tell you what to take and what not to take. Again, that's the way I tell you. Okay, plastic surgeon, you come directly to a plastic surgeon. Same way for the treatment during the pregnancy, go to a gynecologist. They are the best person. They will guide you regarding all this. They will keep you in loop with a pediatrician who will also guide you regarding all those things.
Right.
Third thing is that consanguineous marriages, especially in certain community, what we find is that there is a marriages between the relatives. Now, this is absolutely not a good scenario. It is usually find that these kind of things in a consanguineous marriages happen more frequently than in a patients when there is not a consanguineous marriage. Especially as again, if you look into the current scenario where the marriages are happening at a very later age, and we are finding moms of 40, 45, 50. So now, as the scenario is happening, what we are seeing is that the children are born at a too old a mother. Okay, now this too old a mother is not exactly a healthy mother. So we have found that many parents who become a parents at a very later stage, especially having their first child, they are more prone to have these kind of children are more prone to have these kind of defects than the children who are born to a healthy young female at a Paris age than at a very later age of her life.
What are acquired disabilities due to disease or disorders that you normally see? And what are the causes? And are some of them preventable? For example, amputations, disfigurement, etc., that you see that can come later in life, which are caused by disease or other disorders.
If at all you are looking forward to the most common type where the person gets an acquired kind of a thing, is basically trauma. Okay, not to go into the disease portion. Yes, there are multiple kind of a disease which can cause you a lot of problems. I'm associated with Bandurwala Leprosy Center, where I have been operating these kind of leprosy patients from past 10 years, totally free of cost.
Okay.
From past 10 years, probably I am the only person who is going there to operate. And last, I think since 2011, I have not seen a single other surgeon operating at that place.
Wow.
Yeah, so I have operated multiple of these patients of leprosy, where you get a lot of deformities. There's a losses, then you need to do tendon transfers, then there is a nerve decompression what is required. So apart from the leprosy, trauma is another area where the patients ends up having lots of disabilities and deformities, including amputations. So certain thing, obviously, we have to cater to these kind of patients also. If you have seen recently, one of my cases which I have already posted also on my website, and had a particular good review. We had a case where an assault was on a person, and he lost both his hands. Okay, an 18-year-old chap, he lost both his hands. Right hand also cut and the left hand also cut. So now how he's going to live his whole life? He's a young, healthy guy. So we had reimplanted the hand. It's now almost 4 months. Both the hands are working very well. It was a tremendous case for me, because it's a massive case to be done. So, although we do look upon leprosy and other diseases as other causative factors, we should always realize that trauma is still a major portion where patients get most of their disabilities and deformities, and avoidance of any kind of a trauma. Assault, see, obviously, assault is a very different issue to be discussed altogether. But wearing a helmet proper, wearing a seat belt, driving safely, that's the most important thing. And following the traffic rules, I think, is the most important thing which can prevent all this thing. Leprosy and other diseases, by default, nobody want any leprosy, and even I go to a leprosy center. So you see, there is no way that you can prevent all those things, and you don't know when it's going to strike you. So whenever it comes, you have to get an adequate treatment from them, and you also have to realize that these are not taboo diseases, and they are all treatable diseases. So having a leprosy doesn't make you a social taboo. Yes, you require to undergo treatment for a year or so, but ultimately they're all treatable things. Even the deformities detected and corrected at the right time. So once you have gone with the leprosy treatment, the treatment is over. Come back to a plastic surgeon. Again, don't roam around. Hand ka problem hai, so I'm going to a orthopedic surgeon, and then he is sending us to a neurophysician, and then again you are going to a neurosurgeon, and then again you are going to a different orthopedic surgeon because he was not able to give you the treatment. That doesn't solve the problem. So you have to realize plastic surgery doesn't mean only cosmetic surgeries. So all these leprosy patients, when they require a tendon transfer, or they require a nerve injury happens, so these patients are treated by a plastic surgeon, and a plastic surgeon is the person. So even the reimplantation, किसी की पूरी उंगली कट जाए, or somebody is somewhere, the hand is all chopped off, or even there is a people don't realize, even say for any kind of a bony injury, they would say that no, orthopedic surgeon is the person who is going to treat every bones. No, it's not like that. So if you get an injury to your facial bones, we don't realize the facial bones are treated by a plastic surgeon. The reason, it also involves the aesthetics of the face. So if person falls down from the car, or there's an accident for the car, or there's a fall from the bike or something like that, if the facial bones are broken, the person to treat is a plastic surgeon.
So there is an element of neurology in what neurosurgery in what you do also, right?
Yes, yes, absolutely. All the peripheral nerves, whether it's been due to leprosy or due to trauma, are treated by a plastic surgeon. And in those cases, like even the congenital brachial plexus, we forgot to mention at the time of the first question when we had the discussion about the kind of birth anomalies. Even the congenital brachial plexus or an acquired brachial plexus injury happening where the limb becomes totally flail. The patient is not able to lift the limb or move his hands or do anything. The just hand lies like that on the side. They are also treated by a plastic surgeon. So it's a part of the nerves which is being treated. So when these nerves are not treated, we do tendon transfers, we do microvascular free flaps to make the hand functioning. So all these also come under the domain of the plastic surgeon, and the plastic surgeon is the right person to be taken care, to be handling all these cases.
What about burn and acid attack survivors? I don't hear of too many, thank God, in Pune. But do you get many patients who, you know?
Yeah. Yeah, burn and acid survivors are a very traumatic kind of a situation. Although what we used to see 10 years back, I definitely feel there is a tremendous amount of decrease, and for the good of the society and everyone, it's something which is I feel is happening for the good, that the numbers are decreasing. But yes, the numbers are still there, and it still needs to be taken care of. We are doing whatever best possible. It has not remained the same as it was previously. We treat the patients, we make it sure that from the day one itself that they don't develop contractures. We take care with the newer modalities, like we have got artificial skin covers, so that we can just make it sure that the scarring also comes better and better. We give them adequate measures to see that the finger functions and the neck functions are not restricted. Again, as I've already told you, the majority of the problem in these kind of patients happen when we still see patients where the neck is almost stuck to the chest, or the hands are contracted like this and not moving. See, majority of the cases, what the problem usually happen is that these are not the patients from the cities they are coming these days. These are the patients who have been treated at the villages and the things where they have been continuing with the dressing without any splintage from a local doctor. Not only, I don't blame the local doctor for all these things, because see, the problem is that he is doing what is best possible, whatever he can give the best at his place. He cannot give you something which is not supposed to require. That's why even if I require to consult a urologist or a cardiac surgeon, I would consider him to be the better person rather than take the treatment myself, despite being a qualified plastic surgeon. So the doctor does whatever best is possible for him, but you need to come back to a plastic surgeon to deal with it. So just not go to even a general surgeon. doesn't mean everybody is a surgeon. So you come to a plastic surgeon, he can prevent the contractures from day one. So if the fingers have been properly splinted, the neck has been given a proper collar from the day one, the wounds in a proper manner. Many a times when we find that the patient doesn't want skin grafting, they say, no, I want to continue with the dressing, just heal it itself. So that's not the ideal way to heal it. When you go on healing the burn scar for period of time for a month or two, they end up developing contractures. That's when you get those um, neck line
Stuck.
contracted like this, not stuck over, the fingers not moving and contracted like that. So come to a proper person, and please try to understand, surgeries are not done just because I feel. Every wound, God has been such a nice and a great person, that He treats everything. But if you leave it for ages, everything will heal, but with its consequences. So sometimes surgeries are necessary, not only just because wound will heal even if you leave it for 5 months. But then, is that the right way? No, it will leave with its consequences and sequelae, which we want to avoid. So please come on the right time and definitely get the treatment. Yes, regarding acid burns
Right.
and other treatments, we do provide treatments to patients who have been suffering. Initially I used to have some NGOs and some hospitals helping me out in these kind of patients. Now even I have my center, so I do all these kind of surgeries, whatever it's best possible for them. If it is possible at my center under limited anesthesia, so I do it at my center. Otherwise, I do help these patients at multiple places where I have done. So there are patients who have been actually helping. I do know the patients. I have a photograph. If you want to have it, I can share you a beautiful photograph of a girl. Once initially she used to come to me all covered up. She would not even show her face when she came to me around maybe 5 years, 6 years back. And now she came to me after her marriage, all dressed up in the marriage dress, and she is working and absolutely confident. I even did her eyebrows with a hair transplant, her lip
Oh,
surgery. I
nice.
made her nose, I did her eyelids, I did her forehead, I did her hair. So I did so much of things. For the first two surgeries, I required an institute where I could do um, bigger surgeries and major surgeries when she was, and she's a poor patient, a laborer's daughter. So when she was good enough to be done at my center, I did rest of the surgeries at my center so that I can help her out with other things.
That is so wonderful to know. What are the myths around plastic surgery? What do you think we can do to make plastic surgery more accessible to people who really need it? It has a reputation of being prohibitively expensive and more for cosmetic purposes, though we both know
Now,
it's not true.
now I would break few myths. First of all, thing, not at all. First of all, whether you think it should be made readily accessible, I think readily accessible. It is already readily accessible. The only thing is that it is accessible, but general public doesn't realize it, that it is accessible and it is achievable. Okay, they still go to wrong kind of people, and that makes it more difficult. You go to a orthopedic surgeon, then you come to a plastic surgeon, you don't realize it is accessible. I told you, I'm going to a leprosy center, I treat those leprosy patients. Okay, we are handling burns cases, we are handling congenital anomalies, so it is readily available, it is readily accessible. Okay, it is just that there is no awareness. So accessibility, the question is lost in these kind of scenarios. Even in smaller towns and smaller people, there are plastic surgeons who are visiting there as a honorary people or honorary or a visiting consultant, or it is readily available. I have been there in Pune from almost I would say 12, 13, 14 years. But then initially, in initial days, I used to visit all those peripheries also to give my expertise and do my job over there. So accessibility, I don't think so is a matter of an issue. I think it's more of an awareness where people realize whom to go for what. Okay, regarding the expensive kind of a thing, I would say it is not at all expensive. Okay, now cosmetic surgery is a portion which is actually expensive. I would say still it is not expensive because I operate upon barbers, tailors. I operate upon every other patient nowadays. I don't think so. That is really a concern because it's I do overseas patients also. I get patients from Saudi. I get patients from Yemen. I get patients from Iraq. I get patients from France. I get patients from South Africa. So you see, the cost in India is 8 times the cost, lesser than the cost in other developed countries. And even if this ask our patients from Yemen or Saudi, which are really poor patient nations, They also go to Hong Kong and Thailand, and also to Egypt to get the things. If you compare from Egypt, okay, it might be at par, but leave apart other places, it is definitely much more economical and much more. I'm talking purely of cosmetic surgery right now. I'm not talking of those trauma and burns, which I think is readily accessible and is cheaper. It's not that expensive as what people think. And another myth what you want to understand is that not all plastic surgery is a cosmetic surgery. So plastic surgery is covered under Mediclaim. Okay, if somebody has an injury to the finger, somebody has an injury on the face, somebody gets a cut on the eyelid, somebody gets a cut on the face, it is all covered. You have a nerve injury, you get a left problem, depending on the kind of a Mediclaim policy what you have. It's between the Mediclaim policy and you, it's not between the plastic surgeon. Okay, so all these things are also covered under Mediclaim. So one has to realize that it is not that, it is not only it's just the cosmetic surgery portion which is not covered under Mediclaim, but rest apart everything is covered under Mediclaim. So, and the rates are pre-decided by between the Mediclaim and the hospital and the policy holders. So it is not that it becomes expensive, it's all the more cheaper and readily accessible. Yes, cosmetic surgery portion is a bit still which is under things, because government has its role on there are certain impositions and certain laws which we have to follow. And other thing is that it is, but if you compare country wise, I would say we are doing still the largest number, more than the Americans and the Britishers, and with a good volume of patients, and still 8 times cheaper than what you do it in the outer countries.
That's really good to know. So, depression, anxiety, and stress are also caused, by lack of self-confidence and the way we look. Because this is a world where people pay more attention to how we look than anything else. So, have you seen patients coming to you with any facial? I wouldn't call it disfigurement, but people who are not satisfied with the way they look, and which is causing them mental stress, anxiety, depression, etc. Because psychologically also a person's appearance does impact them, the way society looks at them.
Yeah. No,
When we talk about disabilities, this is also, mental health is also a very important issue nowadays. So do people come to you saying, I want to look better because the way I look is impacting my mental health? Has that happened?
see, now this is a very double-edged sword. Okay, now when we talk of patients having a depression and anxiety due to how they look, uh, now one thing is that there are certain category of patients who are actually having gross disfigurement and they require treatment. And then there are certain category of patients. So if you have a patient whose nose is totally crooked, okay, now he definitely requires a surgery. Now, if you say, I have got you got a long nose and you want to get the treatment for them, you have been socially accepted, you are happy with it, you are living a good life. Now, but if you are still feeling depressed about it, now these are some difficult patients to solve, to be very frank. So there are, I told you, it's a double-edged sword. Definitely it makes a huge impact if you correct those patients and they are happy about it, but to make them happy is another challenge.
Correct.
Okay,
So do you
so
recommend that they
they
meet
would,
a psychologist also? They also get
one,
psychological.
yeah, and they would never be happy even if you make a correction. They would always find some, no doctor, only one side small bulge is there. Oh, come on, man, it's like, we try to give you a proper shape, we try to define the structures. Now it's up to the body also to how it drapes, redrapes, and how does it take you forward. How is the post-op care you take, whether you have been really taking care or you have not been. I find patients who want to do laser, I want to do peel, and then they want to move out in the sun also. Now you cannot do both the things together, you'll get darkened. I cannot avoid it. So you have to realize ki, uh, these kind of patients, anxiety and depression patients, there are two aspects to it. One aspect is that it will definitely, but it is very important for a plastic surgery, and the plastic surgeon is actually going on a very thin line where this depression can be cured by a plastic surgery or a cosmetic surgery, or this depression can lead to further problems for a plastic surgeon. So it's a very thin line to discuss, but yes, definitely grossly disfigured patients, grossly obese patients, patients having gross problem definitely get uh, confident. They do have, I have seen patients who have been doing extremely well, who have been extremely confident, and who have been doing extremely well. So psychological evaluation is a very important thing. But yes, if patient is psychologically stable but realizes what his problem is, It's the right kind of a patient to treat. Okay. Now, if the person thinks that suddenly is going to change his way the life is, no, it's your own hard work, it's your own determination, and it's the way you take your things forward is going to make you only help in making you presentable and making you socially much more acceptable. So grossly deformed patients, definitely, it's a psychological boost for them. Even if not grossly deformed, if you are mentally stable and you realize what you are going ahead with it, and you are stable enough, definitely you will definitely benefit with the cosmetic thing. But if you think the cosmetic surgery is going to change the career and change the life, no, that's what we are not looking forward to.
So finally, do you think, what is your message to everybody who's watching this interview today?
My message would be to avoid quacks. Okay. I would say, first of all, try to ascertain what the problem is. Try to ascertain who is the proper doctor for it. Don't try to look forward who is the cheapest thing available in the town. Okay. Now I have seen people getting hair transplant done at a particular center. Who is doing? You don't know. Okay. No plastic surgeon, not even a doctor. A trained assistant is doing the job. Okay, is that the right way to do it? No, it's not the right way to do it. Okay, so you have to realize you cannot go to get a liposuction or to a dermat or to any other person who is not. But I have find people actively promoting, actively putting that in the newspaper, and people going out also there. Why? Because the only catch for, especially for the Indian patients, I would very rather say for the Indian patients, the catch is only thing. Oh, he gave me a slightly better discount, so I'm going for it. So try to realize, don't go for these things. You will end up spoiling your thing, and then you will keep on repeating one surgeon after other surgeon to get the things done. Well, that will not help out. So, and also you have to realize that was the one thing, that please try to realize what the problem, whom to approach. Second thing, you should always have a third thing, you should always have a qualified person and a trained person to do the things, not go through channels to get the things done. And fourth thing is that you always have to realize whether you really require that or you don't require to that. So if you want a certain cosmetic surgery to be done for it, please make it sure that you get all your doubts clear before the surgery. Make your mind clear, understand the pros, understand the cons, and make sure that you take the right decision at the right time.
Thank you so much. That was a very enlightening interview, and you've shared so much with us. Thank you so much for this. And I'm sure a lot of people would want to also meet with you after they watch this interview. So we would be happy to share your contact details with them when they approach us. Thank you so much, Dr. Saxena, for your time. I know you've had a very busy day, and thank you so much for your time. Thank you, MQ Pharmaceuticals, for being our sponsors. Thank you, Priyanjali, for the back-end support. Thank you, all of viewers, for watching this. If you want Dr. Saxena's contact details, you can get in touch with us. Contact details not only of Dr. Saxena, but any of the doctors in our series, please get in touch with us and we'll share them with you. Thank you so much.